Here's a nice way to memorize the cranial nerves. I didn't make this up, but I found it online, the rule of fours, and it's actually really helped me to memorize where the nerves are at and sort of what they do. So here's an anterior view of the brainstem. From top to bottom, you have the midbrain, you have the pons, and you have the medulla. So they say 1 through 4 lives in the midbrain, 5 through 8 lives in the pons, and 9 through 12 lives in the medulla. The only sort of caveat here is 1 and 2 don't literally live in the midbrain. 1 is above the midbrain in sort of your inferior frontal lobe, and 2 kind of wraps around the front of your midbrain. So it's a bit of a misnomer, but it really helps for concept and to memorize these. So let's get into naming and locating these nerves. I'm going to try to stick to my sensory and motor and both keys. So if you see blue, it's going to be sensory. If you see red, it's going to be motor. And if you see green, it's going to be both sensory and motor. So from the top, this is a representation of your first cranial nerve, which is cranial nerve 1, which is your olfactory nerve. So I'll draw it in blue. And that deals with smell. It's a sense, that's why I've got it as blue. Cranial nerve 2 is your optic nerve. Once again, it's the sensation of seeing or vision, and so I've got it in blue. Cranial nerve 3 comes out of the front of your midbrain, and it's a motor nerve. 1, 2, 3. It's a motor nerve called the oculomotor nerve. And what that does is it brings your eyes towards your nose, and it also brings your eyes up. And the third thing that it does is it has to deal with pupillary constriction. Cranial nerve 4 comes out of the back of your midbrain, and that is your trochlear nerve. And what that does is it sort of rotates your eyes in and down. It's a motor nerve. Cranial nerve 5 is sensory and motor, and it's a big nerve that comes out of the side of your pons, and it has 3 gemini, and it's called your trigeminal nerve. And what that does is it deals with sensation of the upper face and then motor, muscles of mastication of the lower face. So it has both. Cranial nerve 6 is your abducens, and what that's located is right here at your PMJ, your pontomedullary junction. Now I know the rule of 4 says 5 through 8 in your pons, but really 6, 7, and 8 are mostly in your PMJ, otherwise known as pontomedullary junction. So 6, abducens. And what that does, 6 pulls your eyes to the side. So for example, if I'm looking to my right, that's my right 6th nerve and my left 3rd nerve working in tandem. 7 is facial, and that's a sensory and motor neuron. And that has to do with facial sense and facial expression. Now 8 is your vestibulocochlear nerve, and it's more lateral than the last 2. It comes out of your PMJ as well. And this is your vestibulocochlear nerve. And what that has to deal with is hearing in balance. So 9 and 10 are both sensory and motor nerves. 9 is going to be out here, sort of the lateral medulla, and 10 is going to be right below it. 9 is your glossopharyngeal, and I always write it with a lowercase g because to me that looks like a 9, and that's how I memorize that. So glossopharyngeal, and what that has to deal with is some strap muscles in the back of your throat, and also it aids in your gag reflex, cough, and swallow reflex as well. Here's cranial nerve 10, and that is your vagus nerve. Your vagus and your glossopharyngeal nerve work together for those reflexes I just listed. Your vagus nerve also plays a huge role in your parasympathetic nervous system by, for example, slowing down your heart rate for the vasovagal response. Here is 11. It's your spinal accessory nerve. I'll just write accessory. And it's red, once again, because it's a motor nerve, and the way you test that is with shoulder shrugging and neck movement. And last but not least is 12. And 12 is your hypoglossal nerve. And what that does is it deals with tongue movements, so motor movements of the tongue. So to talk about a couple reflex arcs real quick, so you have an input and an output. One that's really common is the consensual light reflex or the blink to threat reflex, in which case what you'll do is you'll kind of make a fast movement in front of someone's eyes, and their optic nerve picks up the fact that they have an incoming threat, and their facial nerve, 7, actually closes the eyelid. So it's supposed to look something like this. And you're checking the loop between 2 and 7. Another example of that would be the corneal reflex, which is something you do with a comatose patient or somebody you suspect is having or in coma. What you'll do is you'll take a piece of gauze and touch the whites of their eyes, and if they're awake or if they're responding, what will happen is their eyelid will snap shut. And that reflex arc is 5 is taking the input to you rubbing on their eye because it's sensation of upper face, and 7 is snapping that eyelid closed. So that's another reflex arc. The third one that I want to highlight, I mentioned it a second ago, is 9 and 10. And something that you're often doing if you're considering protecting somebody's airway via endotracheal intubation, you want to check to see if they have a gag reflex. So what you'll do is you'll take a popsicle stick, put it towards the back of their throat, and manipulate their posterior oropharynx, and what you're expecting is for them to sort of gag or retch. And so in that case, 9 is receiving the input, and 10 is carrying out the gagging or retching. Anyways, this is how I remember the cranial nerves and brainstem and sort of where they live on this board.